Hello and welcome. I'm delighted you could be with me tonight because we have a very, very important show for our communities and for families. We're going to be talking about the impact of Alzheimer's on our communities throughout the state and region. As you probably know, Alzheimer's is considered now a public health crisis, and that's because baby boomers are reaching 65 now. There is no cure yet for this disease and really no good way to stop the progression. And so this means a lot of people needing health care. And already our healthcare system is pushed, as we all know. We're going to talk tonight with two leaders who are very involved in an exciting, innovative program that's being picked up around the country. We're going to talk about ACT on Alzheimer's, and with me, first of all, is Sue Spaulding. Sue is the Executive Director of the Alzheimer's Association of Minnesota and North Dakota. And you've been there about 4.5 years, you said, Sue?
Yes.
First time on the show, though, so.
Thank you. We're so excited to be here.
Welcome. Our second guest is Dawn Simonson, and Dawn is with the Metro Area Agency on Aging, and you've been there about 14 years.
That's right, yes.
So welcome to you.
Thank you, Mary.
Well, we recently had airing on TPT and PBS a special called Alzheimer's Every Minute Counts.
Right.
And it was publicized well, and I think a lot of folks saw it and are talking about it. How did you feel about it? Did you feel it represented the state of things pretty well?
Yeah. Should I start?
Sure.
Sure. So I think that what the Every Minute Counts really does, it helps people understand just the enormity of the disease and the scale of Alzheimer's and its impact. So that was very purposeful in terms of the focus of the documentary. And in addition to just helping us understand the need for research and funding for research, it also made us care about the individuals featured in the documentary.
That's what I thought maybe was my main takeaway.
Yes.
And life stories of these families.
Right, the family in Florida and Daisy and her mother. And so not only do we have some sense for this crisis, as you described, but also we really care about the people we see on the screen, and we can relate to those individuals and their families, and we see ourselves and our own families.
Mm-hmm.
Yeah.
And get scared when we watch the PBS special and think of our own families.
I think it's surprising, though, that not more people are concerned because of the growing number of people that are going to have this disease and the escalating costs. So I hope that the documentary brings really that to heighten people's awareness, to say this is an issue that we need to address and need to address it now. But what I also felt was so much hope, because you see that there are some support and resources, and there are some exciting things happening in research, in public policy. And so being behind the scenes, like with Dawn, I think, there's so much we can do to help people. So if they contact one of us, we can be right there to go with them on this journey.
Do you think there's some stigma about dementia in general and Alzheimer's in particular that has caused people to not be more talking about it as families, as community members?
Oh, absolutely. There's a lot of stigma around the disease, and that's why we really encourage people who have the disease and their family members to talk and bring their stories and share their stories so that people can break down those stigmas. Because people can live well with this disease. But
At least for a while, of years,
yes.
Right?
But it is a disease where it's not a physical disease often, so you can't see that you're sick. And I hear that all the time. Well, you don't look sick. Well, what does Alzheimer's look like? It looks like many different things. It's different in each person.
Right.
And that makes it, a little harder to identify with. The numbers now, I know 1 out of 3 people over 85 will probably be diagnosed with it. How about the younger, older people?
Right, so that 1 in 85, we hope that people are diagnosed. I think that's what we understand, that the numbers of people who will have the disease, but we know far fewer are actually diagnosed. And then for the younger population, 1 in 9, 65 plus, will have Alzheimer's. But as we know, people often do not receive a diagnosis, and so many people have Alzheimer's or another dementia, and they're not diagnosed. And that diagnosis is just critical so that people can plan, so that they can plan for their care and their financial future, and their family caregivers can be part of that planning.
So I just want to clarify, so 1 out of 9 over 65 will be diagnosed, or will have
the disease.
Will have it, maybe not diagnosed.
Right.
And 1 out of 3 over 85.
Yes.
Well, I was going to say, I think, age is the leading factor of Alzheimer's disease, so that's where they've kind of picked that number 65 and then come up with those numbers. But you can get Alzheimer's disease at any age. And that's why one of the reasons it's so important to go in and try to get a diagnosis is because you can be 50, you can be 40, you can be 30 years old and be diagnosed with Alzheimer's disease.
That early onset Alzheimer's is faster developing, isn't it?
It certainly can be.
It
certainly can be, but then you also, if you're in a good shape and at age 50, you can live a really long time with the disease too.
Yeah, I do think we think of it as an older person's disease, but it's not always. The cost, one of the numbers I heard on the special, I want to check it out with you guys, is that the budget to take care of people with Alzheimer's will not so long down the road be about equal to our defense budget. And I was shocked. That took me back when I thought of that.
Right.
So right now, the federal government spends about $236 billion a year to care for people with Alzheimer's disease. That's Medicare, Medicaid, and private pay in there. As the numbers triple in the next 30 years, it's expected to go into the trillions. So that's where you're heading into that. So think about that, and we're paying for all of that. And if we don't find some kind of treatments or cures to slow this down, it will break the federal government bank.
And that's something we have not heard our politicians talk about, have we? It's maybe too hot of a potato. But that's an important thing for policymakers, everyone to get.
It is important, and I think part of why we don't hear about it, part of it is the stigma, but part of it is that because it is often a disease of older adults, we're a youth-oriented society. We don't particularly want to focus on aging and age-related disease, and so I think that's part of why there isn't the attention and focus on Alzheimer's, because it is related to aging, and aging sometimes is not popular.
I would say, though, that is also a message that we take to Washington, D.C. every year with the Alzheimer's Association, and we advocate for more dollars for research, because we look at that scale and the amount of money that the federal government puts into research right now. And if we could change that scale just a little bit and come up with something that slowed it down by even 5 years, we could save billions of dollars.
I read somewhere, and I want to check with you, but that there are about 80 drugs that are being studied right now. Does this sound right? And I thought, that sounds good. Maybe there will be a breakthrough. And I think that's what we all hope for.
I think we all hope for that, and I think we hope for drugs that, I think the promise in the research is really for, often someone will have Alzheimer's for 20 years before the symptoms manifest. And so really the great promise is in finding drugs that will help someone at that early part of their disease process, as well as if they are diagnosed, if they are showing symptoms, that will help to slow the progression. And I think we can be hopeful that there is excellent research happening all across the country, certainly research here in Minnesota through the Mayo Clinic, through Health Partners, and others. But we do need resources to be certain that we're adequately funding that research. I think when we think about the PBS special, the comparisons that they do related to other major disease categories like cancer or HIV/AIDS, and we look at the comparisons with Alzheimer's. Alzheimer's doesn't have the level of resources
so
that it will take.
in spite of the numbers that are going to be affected,
Right.
it's disproportionately
It is.
researched and funded, isn't it?
But within our, I mean, I think I think Sue and I both think that there's hope there, that there is research can be done. We can find promise in the future, but it will take resources.
Well, and one of the things that's neat to see is that we've dumped a lot of money or put a lot of money into cancer research and heart and stroke research and HIV/AIDS research, and with that we brought deaths from those diseases down because we know how to treat, we know how to prevent, we know a lot of the things to help people. So while all of those diseases are going down for death rates, Alzheimer's has increased by 70% in the last 10 years. So that's why it's important now to bring in more funding for research for Alzheimer's disease.
So say that again, Alzheimer's is increased 70%?
70% in the last 10 years, deaths from Alzheimer's disease.
And why do you think that's the case? That's a huge
Well,
jump.
part of it's because we're not dying of heart attacks and strokes in our 40s, 50s, and 60s. We're not dying of cancer at the rates that we were before. So now we're living longer,
so
but
then
having
more
other
people have
problems.
Exactly.
brain
Right.
diseases, yes.
Exactly.
I don't know if we haven't stated this, but Alzheimer's is one form of dementia, the most common form, correct? And I read somewhere that about 80% of people that have dementia have Alzheimer's. I hadn't realized it was that common, but is that correct?
Yes, it is.
You know that better than I do.
It is.
Yes,
So it's about 70-80% of people that have dementia, it comes in the form of Alzheimer's disease, but there's about 50 different forms of dementia. So it comes with vascular dementia, Lewy body dementia, there's dementia with ALS, there's dementia with Parkinson's disease. So there's many different forms, but Alzheimer's is the largest form.
And probably the one people fear the most, I'm guessing. Maybe they shouldn't, but it's the one people talk about. I want to go back to cost just a little bit and talk about the cost that families need to be aware of, because I think there's some myths about having coverage when you have Medicare, and that's
Right.
not true, right?
Right. So when we think of the costs that families bear, we need to understand first what Medicare covers and what Medicare doesn't cover. And so Medicare will cover acute illness, preventive care, hospitalization, a little bit of nursing home care, but again, when it's really medically necessary and not considered custodial care or care that would often be common with Alzheimer's.
So they're not paying the monthly nursing home bill.
Medicare will not, right.
Right.
And so first, often what happens here in Minnesota, and very common in other parts of the country as well, is that someone needs to spend down their own private resources in order to qualify for Medicaid, which is the other public entitlement benefit here in our country for people. But the key there is that you do need to spend down all of your assets in order to qualify for Medicaid, and then Medicaid generally will cover your nursing home care.
And it's spending down to what, $3,000?
It's about there, and
It's very low.
Right. There are protections for spouses, for the spouse who lives in the community. So I think that's important to know that we want to be sure that the remaining spouse who remains in the community has supports, and so that spend down doesn't completely impoverish a married couple, but important to understand
They
that.
split their assets, right? And the spouse can stay in the home.
Exactly.
Correct.
Yes, in a nutshell.
So that's important to know. But
Right.
Insurance, long-term care insurance would cover people, but
Yeah.
that's not something that's real common.
Not real common, and again, long-term care insurance policies really differ, and so depending on how old the policy is, what the benefits are, they can really vary. A very important benefit, and we wouldn't discourage anyone from considering long-term care insurance, but again, need to really understand what you've purchased. And just the reality is that it's hard to predict the future. So you're insuring for a future that you don't have. You don't have a crystal ball into your own future. I think the other piece too is that when we really think about people with Alzheimer's disease, they do live in the community, and most will live in the community and not in a nursing home. And so, so part of that financial piece for families is to pay for care that's delivered in home. In addition to thinking about the financial implications for a caregiver, and that might be if someone's diagnosed early, say with early onset, then what does that mean for that working spouse perhaps who may or may not be able to stay in the workforce, and what does that mean for their long-term financial stability?
It doesn't just affect the patient, does it?
Exactly.
Right, or the person with Alzheimer's. I want to switch now gears here a bit and talk about community strategies and what's going on with Act on Alzheimer's.
Yeah.
Do you want to, Sue, just define? And it's
on
not
Alzheimer's?
easy to define
No.
Act on Alzheimer's, but do you want to?
Well, it's a real collaborative of people that came together that were concerned about Alzheimer's disease and dementia. And we went to the state legislature 8 years ago, I think it was now, and said, you know, we need a plan because Minnesota is going to be faced with a tsunami number of people that have Alzheimer's disease. So what are we going to do? How are we going to care for these people? And so the group got together, and there was an Alzheimer's disease working group that made a state plan. So there are actually 48 states that have state plans, only 2 that don't. So that's pretty exciting. And then instead of just putting it on the shelf and saying, well, there it sits and isn't that great, the group really said, we need to actually put these things in place. So what are we going to do? So they sat down and gathered more people to tackle it, and really all the things that have come out of ACT is because of the state plan and how we moved forward.
So about how many agencies did you say were putting their heads together?
Were there 30, 50?
Initially, and now I would say that there are literally hundreds of organizations and thousands of people pooling their efforts.
Energy.
Right.
When we think of ACT, one of the things that it covers is what's called dementia-friendly communities. And when I heard that phrase, I thought, now what does that mean?
Yeah.
How do you define, and what does a dementia-friendly community look like?
Right. Well, a dementia-friendly community, if we think about it just at a really global level or a high level, is a community that supports someone with Alzheimer's and their family, where there is knowledge, the community is informed about Alzheimer's, where there's respect for people with Alzheimer's, and where the community is inclusive of people with Alzheimer's. And so educational
programming.
Yes, so
speakers coming in.
Right. So what
awareness.
That means then, particularly the ACT on Alzheimer's model, is to say this is everyone's issue in the community, and that in order for a community to become dementia friendly, that we need all sectors to come to the table. And so that means that we have our healthcare sector at the table, our social service sector, we have government agencies, law enforcement, financial planners, lawyers, retail, bankers, and really every libraries. So really every sector of the community, voluntary sector, faith communities. Schools, education, right. And the work of ACT on Alzheimer's has been to educate, certainly, and inform people about Alzheimer's, and then to engage them in prioritizing what their community could do to support people with Alzheimer's disease, and then to prioritize that what could we do list and take action.
So I'm thinking it could be that a dementia-friendly community would look very different from one town or city to another, right?
Absolutely.
Depending on their prioritization and
what they have already for resources or what's in their community. Definitely.
Yeah, that's interesting to think about.
It is.
There's not a cookie cutter look to a dementia-friendly community.
Well, and I think one of the reasons this is so important is we talk about the number of people that are going to be diagnosed with this disease. No one agency or organization or health system can care for everybody. So this is a way to really support everyone who has Alzheimer's disease or other dementias and is impacted. And education is one of the biggest things of knowing what you're dealing with. And so that's why it's so important for the community to become educated.
Would that include educating young kids too in the school, elementary and junior high and high school?
Oh, absolutely.
I'm thinking that, our whole way of viewing aging, as you said, is not really healthy.
Right.
And it really needs to start early, don't you think, in terms of how we talk about it?
Oh, definitely. Well, I think some of that stigma that we talked about earlier is because people don't know how to interact with a person with dementia, or they're scared. And if you can educate the younger ones and they are not scared of this disease anymore, what a difference that will make in how people are treated with this disease.
And I think there's also a big question in people's minds. Does a person who is confused, showing signs of dementia, do they care if I visit with them or interact with them because they seem so confused? But really, research tells us, doesn't it, that
I think that's human nature, to crave to have interactions with other people,
even
and
if
to
it's not like it used to be, right?
and to feel those connections. And definitely, they've shown lots of evidence that yes, just talking with a person, touching a person, all of that is really important to a person's quality of life.
I remember seeing a movie called Peach years ago that talks about a family visiting a grandmother with Alzheimer's, and it's a touching movie that is a great resource. I'm sorry, you wanted to.
Well, I was just going to add both
too.
to Sue's comments as well as just to go a little deeper. So when we say, what does a dementia-friendly community look like? And part of it can be, for example, educating the retail community about how to interact with someone with dementia. So if someone is struggling at a cash register or doesn't know how to use their credit card, say getting groceries, training that workforce. Act on Alzheimer's has a whole training offering on dementia-friendly at work. So helping the retail community or the, for example, government services community or libraries recognize the signs and symptoms and then feel comfortable in how to interact and put that person at ease. Taxi cab drivers, bus drivers, law enforcement personnel. Some of the work in Act on Alzheimer's has been for faith communities to really spend time, for example, with their sermons on Sundays, or establishing dementia education groups, having special activities for families who are dealing with dementia. So part of what we're trying to do with Act on Alzheimer's is normalize dementia to some degree. And one of the ways that we have to do this, a tool, is a program called Dementia Friends, which is a program that came out of the Alzheimer's Society out of the UK. It's really a global movement. There are 10 million dementia friends around the world, and Minnesota is the first, through Act on Alzheimer's in the United States, to adopt the Dementia Friends program. We have 5,000 dementia friends in Minnesota, and we're working on having 10,000 shortly by the end of the year. But the Dementia Friend is something that's very applicable to youth as well, and so we'll be taking dementia. We already have it in place, but spreading that. And again, it's to help people understand the disease, recognize when someone might have the disease, and then learn how to feel comfortable interacting, and then really important, making a personal commitment to how they will help to improve the lives. And it could be something very simple.
So it really means being respectful, being kind, being patient, right?
Yes.
All the things we should do every day. Yes.
Right.
But when people aren't, understanding why someone's acting the way they are, it's understandable too that sometimes they're not patient, kind, and respectful. But this sounds great. We only have a few minutes left. I want to be sure that I ask the question about communities who are listening and interested and what they need to do to get on board, because it sounds complicated, and yet can you speak to that, Sue?
Sure, a little bit, and Dawn, please chime in too. We encourage all communities who are interested to get involved, and you can go on the Act on Alzheimer's website, and there's actually a toolkit for communities right there that kind of walks you through the process of what you need to do to become a dementia-friendly community. It's really easy.
We're going to just take a pause, you guys, and give you some resources, and that will be one of them, because we've got several tonight, and I want to be sure that you have time to write all this down or to take note. So first of all, if you missed the PBS special that we've been talking about, and enjoyed and learned from. You can find that yet online. I'm going to just have my graphics people put that up, but know that it's still available and you can check it out. And then secondly, Sue's organization, the Alzheimer's Association of Minnesota and North Dakota. The website is www.alz.org. You have a 24/7 hotline.
We do.
And that sounds wonderful for people. 2 numbers for you, 1-800-272-3900, or the TDD number, 1-800-403-3073. And then the Act on Alzheimer's website that you just mentioned, it's www.actonalz.org. And here's where you can get the dementia community toolkits,
Yes.
dementia-friendly toolkits. And they sound, very practical and helpful. And then your organization, Dawn, the Metropolitan Area Agency on Aging, www.metroaging.org, phone number 651-641-8612. And then finally, one more number, and this is another handy one to know, the Senior Linkage Line. And some of you, I'm sure, have used it. They're open Monday through Friday, 8 to 4:30, and it's 1-800-333-2433. And they could direct you to any of the above resources and also answer other questions and make referrals.
Exactly.
I want to quickly ask the role of the physician. We don't have enough geriatricians here in Minnesota. What kind of pressure is this big burgeoning crisis putting on doctors, and are they ready?
I don't think doctors really are. There's still a lot of resistance to diagnosing Alzheimer's disease, and partly because I think it's an aging disease, and people think, well, they've lived a good life, a long life, and it's okay. And anytime you have a disease, you should be diagnosed and know what you have. And there are so many other things that can exhibit signs of dementia that you want to make sure you have a diagnosis of Alzheimer's disease so you know how to plan and how you're going to live with this disease.
Well, on that note, we need to close, but thank you both so much
You're
for
welcome, Mary.
coming
Thank you so
down
much.
and,
Thank you, Mary.
and shedding a lot of
Thank you. Yes,
good information and light on this
Our pleasure.
big topic.
Thank you.
Thank you both. And thank you for being with us. I'll be back again next week. Until then, have a good week and check out all these resources. They're great. Bye-bye.